All right, these next special tests are going to be looking at distal biceps tendon integrity. So if someone comes to you with kind of a vague anterior elbow discomfort, swelling, describes a mechanism of injury as being something like they were reaching for something, or their arm was pulled, or they were hanging onto something, they felt a pop in their elbow, or lifting heavy weights and felt a pop, you may be suspicious of a biceps tendon rupture. And so the way to check for that is you're going to do two different special tests, okay, in the clinic. And these tests might lead you then to going on to imaging to confirm this. But the first test is just going to be a palpation test. It's called the biceps hook sign. And so literally you're going to take your finger and create a hook and try to find the distal biceps tendon in the antecubital fossa and see if you can palpate and make sure it still has its integrity. So you just have the patient open up their arm if that's tolerable, and you do a light or gentle resisted isometric into elbow flexion. And what you should see there, obviously, is the bicep. You should follow that down until you see the bicep tendon. And so we can see in Logan here, he has his bicep tendon intact. But the test will actually use a hook, and we'll try to palpate underneath of the tendon. And so here we go. We obviously have a negative test here. A negative test, so this is how I specify this in notes. A negative test for me is when I feel that he has an intact tendon. So because what I'm looking for, a positive test would be I can't palpate the tendon. And so in notes, you can kind of get mixed up there. So you should really just write out palpation of tendon. Is it apparent or not apparent? Something like that, instead of having a positive or negative test, so that your documentation is clear. And then next, we do what's called a muscle squeeze test. And so we're going to actually literally squeeze his bicep and see if there's function down the chain. So we're going to try to simulate a muscle contraction with this squeeze test. So you place the patient in slight pronation, and because the biceps brachii is also not only an elbow flexor but a forearm pronator, or excuse me, supinator, as we squeeze the bicep, we should see, as an intact tendon, the forearm supinate. So it's literally just come in and you give a nice squeeze to the bicep, and you hope to see a little tiny supination of the forearm.